to say.
Where's Dwayne? Dwayne's going to start off, okay?
Okay.
So.
Wendy, you want to start off? Please start off.
Yeah, we can't wait for Dwayne.
No.
We're ready.
I think that Dwayne was going to give a little welcome.
Yeah. Well,
okay. Good evening, ladies and gentlemen. I was talking to myself.
I guess you were. Holy smokes.
Welcome to our community talk. And tonight, I will introduce to you the Black Women's Alliance Group as Wendy Wilson. Thank you, Wendy.
Hi, hello, actually good evening, and thank you for coming. My name is Wendy Lee Wilson, and I'm with the Nova Scotia Black Women's Alliance. So currently we're a small group. There's myself, Karen Hudson, Marcia Hudson-Ash, Dr. Barb Hamilton-Hinch, and we are a platform that's interested in collaborating with groups and individuals to deliver speaking engagements and conferences with a focus on Black women, health, and education. So right now we're looking to build a database of presenters and participants
should go join us
for conferences, summits, symposium, and other speaking engagements. So if you're interested in being a participant and doing a speaking engagement or a presenter or a participant, you can reach us at Nova Scotia Black Women's Alliance at gmail.com. I'll add that to the chat. And just a little bit about us and how this group came together. Back last year in the fall, I believe, myself, Marcia Hudson-Ash, and Karen Hudson, we got together because we realized we had some common interests in that there were more opportunities needed for Black women and practitioners to educate each other and share information. We also realized that we needed to do a needs assessment. We were going to have a conference, a needs assessment / mini conference in Halifax on the long weekend in May. But because of COVID, we weren't able to do that. So we still want to do that, and we still want to get the perspectives from Black women across the province. So get in contact with us if you're interested in participating in that way. We still plan to do a conference in collaboration with the Nova Scotia Black Men's Health League. That's still the plan. We don't know when and how that's going to work. Originally, it was planned for the fall of 2020. And the other thing that we're currently doing is we're going to be hosting Black women once a month in this format, so on these Zoom meetings. Once a month, we're going to be bringing a speaker from a Black woman from the community, speakers / practitioner to present at these meetings. So I'm going to turn it over to Karen Hudson right now. And Karen is going to introduce our speaker for this evening. So thanks for joining us.
So good evening, everyone. And our speaker hails from the African Nova Scotia community of Beachville and Cherry Brook. Wow, how did I say that? Anyway, it's part of our community. Her father, the late Norman Hamilton, and also Bernice McLaughlin, who's from Cherry Brook. She's the proud mother of 3 boys, and one of her sons has 2 children, and she's also a grandmom as well. She did her degree, a Bachelor of Science in Recreation at Dalhousie University Management, a Master of Arts at Mount St. Vincent University, and then she did her Bachelor of Education degree, secondary, and then completed her PhD at Dalhousie University. She's an assistant professor, and she completed her studies in health and human performance. Some of her primary areas of research is in institutional and systemic racism, diversity, inclusion, mental health, social determinants of health and equity, and justice. This young woman is community center. She's the original founder of Imhotep, as well as a co-chair of PLANS, which is promoting leadership in health for African Nova Scotians. And she's also a member of the Afrocentric Learning Institute, DPAD, and HAWK. On this note, I would like to introduce to you, I should say one other thing. She's also considered to be one of the first Indigenous African Nova Scotians to graduate with a PhD from Dalhousie University. So that's some great accomplishment. On this note, I'd like to introduce to you Dr. Barb Hamilton-Hinch.
Mommy. Again. What's there?
Is she there? And her talk tonight, as you can see her slide, Black Women in Health.
Looks like she's on mute.
Oh, Barb, you're on.
Okay, thank you for that introduction, Karen. I wasn't expecting it to be that long, so I appreciate all the comments that you gave. I'd like to encourage everyone who's on the call, because there's many experts on this call, to also participate in the discussion and bring your expertise. I am because we are. And I acknowledge that we are meeting on unceded Mi'kmaq territory, and I also recognize the shoulders of the women who've gone before and other people of African descent. If it wasn't for their sacrifices, we wouldn't be here today, and it's important to acknowledge that. So what I have decided to talk about today, under the direction of my sisters, is Black women in health. So we're just going to jump right into it. Some of the things that we're going to hope to cover today is I have my 30 minutes and I have my TikToks. I'd like to have more discussion. And as I was saying that to Dwayne and Mario, they're like, oh, you know, just take the time you need, but hopefully it'll be engaging enough so that it doesn't seem like long. So we're going to look at what does health mean? What do we mean by health? Looking at some of the health disparities, relating health to being Black and women in Nova Scotia, looking at the social determinants of health, a little peek at adverse childhood experiences and what do we mean by that, women's work, racism and health and its impact on us, and the importance of race-based data, next steps, and keeping it real. Let's have a conversation. So that's what I hope we're able to do together tonight. And so, true story. And so if I'm a little flustered today, it's always good to start with stories. And I was talking to my sisters in preparing for this. They said, you know, you're a storyteller. So I had somebody else's story there that I was going to tell, but I'm going to tell a story. And this is about the story of a mother and two sisters and a son. And today, these individuals went to the hospital for just a regular checkup. And while we were at the hospital, we decided Mom was having a kink in her back for the past few days. So we said, okay, we're going to take her to get this kink checked out. We're going to force her to go because she hasn't been sleeping for the past 3 days. And she does sometimes get tinges in her back, and she's fine. So no need to spread the rumor. Oh my heavens, Bernice is in the hospital. It was just us trying to figure out how to get her back pain out. Because sometimes when she gets it, she just goes, she gets an injection of morphine and she's fine. So that's what's probably going to happen today. As you know, COVID-19 is happening right now. And I don't often use that doctor title in spaces, but I do use it in white spaces. And so what I mean by that, after we finished taking Mom for one of her appointments, we convinced her to go to get her back checked in the emergency. And in the emergency, there's not supposed to be any visitors. It's supposed to be just the patient. So there we are, the three of us. I convinced my brother and sister to wait outside. We go into the emergency to check her in, and there's a little young white female sitting behind the counter. And she's so quick to tell me that I'm not allowed in. Meanwhile, I'm seeing other people who have support inside. So my mother's 81 years old and in a lot of pain. So I allowed her to finish her whole story about how I couldn't go in. And I said, I'm going in as far as I can with my mother. There's other support people in there. And she goes, well, you don't know their condition. I said, and you don't know my mother's condition. And I said, I just want you to know that we know, and I used the we words, she knew what I meant. There's often different ways that you treat some of us. And today is not the day. And she got all flustered and she was like, okay, you can go in as far as triage. And I said, that's all I want to do. I need to tell them what my mother's experiencing. I'm not leaving it up to my mother to tell them what she is feeling. And that was really frustrating for me because at that time, we were the only people of African descent in the waiting room. There was many other people of European descent and many who had support people with them. So I questioned that. I really question that. I leave you with that thought, because that's our lived reality as Black people. And it's even more so our lived reality as Black women, when we have to advocate for things that we shouldn't have to advocate for. So that's why the idea of Black health is so, so important. And us demanding equitable treatment, no matter what that is. So I just wanted to share that story. So if I feel flushed today, that happened just like my mom's still there. I left my sister with her because I had the talk today. So it's still very raw. And when we stepped outside, we said, and people wonder why we get angry, why we show our emotions. So I leave you with that. So what do we mean by health? And so for today, I'm using the World Health definition of health, which basically is that health is a state of complete physical, mental, social, and well-being, and not merely the absence of disease or infirmity. Now, this definition is from the World Health Organization, and it's been their definition since 1948. They haven't changed it, and it is a very all-encompassing definition. But we also know that many of us who are of African descent don't experience this type of health for a number of reasons, which we'll talk about. And so the Center for Disease Control and Prevention talk about health equity and health disparities. And it's just important for me to go through this really quickly, and I encourage you to go to some of these links, and I will share the slides later today. So health equity is achieved when every person has the opportunity to attain their full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. And so we have to ask ourselves, do we experience health equity in the healthcare system in Nova Scotia? We experience health disparities or inequities, which are the types of unfair health differences closely linked with social, economic, or environmental disadvantage that adversely affect groups of people. And in saying that, I'll go back to my story, and my story will probably be weaved throughout today. We always have to be very conscious as Black women and Black people when we go into white spaces. So we make sure we look good. We make sure that we're dressed properly. We make sure that we're articulate in how we speak. So we checked all those boxes today to make sure that there was no judgment that could be passed on who we were as people of African descent. Yet, we still experienced it. When we talk about relating Black health to women and women in Nova Scotia, I just want us to take a minute to understand a little bit about the social determinants of health. And one thing I love about Black women is the different hues that we experience. We're mocha, we're chocolate, we're vanilla. We have a number of hues within us as Black women. And we experience different levels of racism, sometimes even based on our skin tone, which is another conversation around colorism that I would be happy if someone took that up or had discussion around that. And so the social determinants of health, and again, I encourage you to, when you have the slides, to link to this. The social determinants of health are the aspects of the environment, and a lot of this we have no control of, in which we're born, we grow up, we live, we work, we age, as well as systems that are put in place to deal with illness. And these aspects are shaped by a wider set of forces, such as economics, social policies, and politics. And even in having a conversation with my sisters or Women's Alliances, we talked about this. One thing we are often up against, and one of the social determinants of health, is education. I want you to look at this slide for a minute. What makes Canadians sick? And you'll see where the 50% is 50% of your life. It's broken down to 100%. So 50% of what makes us sick is contingent on the social determinants of health. So if you look at income, early childhood development, disability, education, social inclusion, social safety net, gender, employment, working conditions, race, Aboriginal Indigenous status, safe and nutritious food, housing, homeless, community belonging. Think about ourselves as people of African descent. Think about ourselves as women. How much inequities exist within what impacts our life by 50%? So think about that. Think about where you are with your education, where your children are with their education, what our education system experience is like, what we experience in our places of work around microaggression and macroaggressions, what we experience such as going to the hospital for care, what our income varies are. We know that many people of African descent, and particularly women, are often in low income service positions in a lot of cases, caring positions. So if 50% of your life of you being well is contingent on things you cannot control, there's no reason why we have to ask ourselves, why are we sick as people of African descent? Why are we experiencing disparities in health as Black women and Black people? 25% is your healthcare, access to healthcare systems and wait times. So if you combine that 50% and that 25%, we're already at a disadvantage by 75%. If you think of some of our older women who don't have a healthcare plan because they were workers in the home, they were day workers, they cleaned, they took care of predominantly white women's homes. So many of them do not have a healthcare plan. Many seniors in this case don't have a healthcare plan. And the wait times. And we know from research that often people of African descent experience longer wait times than other racialized groups. We also know that we're often denied certain operations because of some of the stereotypes that exist, such as renal operations. And we'll go into some of the other conditions. 15% is your biology, your genetics. 10% is your environment, air quality, civic infrastructure, so on. So just think about that. So why are we experiencing different levels of sickness within our Black community? Another aspect that we don't often think about is our adverse childhood experiences. And this is a research project that I'm involved in with a couple of women in the School of Social Work, looking at adverse childhood experiences. We don't often talk about that as people of African descent. We don't often talk about mental health. We don't often talk about historical trauma. And if you don't deal with some of the historical trauma that we experienced as a child, that can show itself in other illnesses and conditions as adults. And we are seeing that. So adverse child experiences are often people who witness growing up domestic violence, physical violence, emotional abuse, emotional neglect, intimate partner violence, mother treated violently, substance misuse within the school, within the household mental illness, separation or divorce, incarcerated household member. We know the population of the number of people of African descent in our prisons. That's another research that I'm connected to. So there's very few of us within the African Nova Scotian community who do not know someone who's been incarcerated that is closely related to us. I'm sure we know individuals who have experienced intimate partner violence, who have experienced sexual abuse, emotional abuse. But we don't talk about these impacts of these childhood experiences. And this isn't always it being done to, it can also be witnessing it. And so that does affect our health. And so looking at the social determinants of the adverse childhood experiences and layering that with the social determinants of health, you would see that our adverse childhood experiences can affect our social, emotional, and cognitive impairment. It can affect the adoption of health risk behaviors, such as alcohol, drug abuse, even sex abuse. It can increase our risk for disease, disability, and social problems, and often result in an early death. And some of the disease that we often are more prone to get because of our experience of racism in the healthcare system and because of the social terms of health and early in the adverse child experiences, cancer, heart disease, liver disease, chronic disease, skeletal fractures. The list goes on. And all of this is founded in research. And again, just talking about how the long-term effects can affect your mind, your body. And we don't do enough of practicing mindfulness. And that's again, because we as Black people don't think about mindfulness. We don't think about mental health. We don't think about taking care of our mind, body, and soul. And we do need to do more of that. This here is a sneak peek at some of the questions from an ACE questionnaire. And you can easily Google ACE questionnaire and it will bring up a questionnaire. I don't encourage people to do that unless you're with someone who is certified to help understand the ACE scores, because it can be very emotional for you when you realize that you have experienced some of these challenges. And often folks who experience two or more of these adverse childhood experiences are at risk of having challenges as an adult with their mental, physical, emotional health. So these would be some simple questions. Did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? This also calls into question, and it would be exciting to do parenting workshops, what we do as a parent. Do we talk about adverse childhood experiences as a parent and some of the behaviors we may contribute to our children developing this? I can tell you that I'm not immune to having yelled at my child and said things. So all of us might have done some of this at some point to our children. Did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or even hit you hard that you had marks or were injured? Going down to another one, did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? So again, not saying that all these things connect to our people of African descent in our community, but ACE scores are another way to look at how is our health being impacted by race. And there are some questions that go on and talk about some experience of racism as well. So I encourage you to look at that if you have the time. So Black women's work, and I'm using X because I was just doing a proposal defense with one of my students, and I should have had it on my first slide, is that women do not want to be defined by men. And so X is almost like how Prince took back the X as, was a symbol for a while, not Prince, and he went through that whole experience. So it's important to think about this as Black women. There is no such thing as a single issue struggle because we do not live single issue lives, and that's Audre Lorde. So there's no such thing as single issue struggles because we do not live single issue lives. And so on that street sign, you see our experience of racism, sexism, heterism, ableism, colonialism, classism. We bring all that to the table. It's how people manage it and how people treat us is what affects our health and our well-being. And saying that most women are the primary caregivers at home and in the community. So not only do we care for our family in our home, but we care for the community. We don't have to look no further than what's happening with COVID-19. We do have some men that are engaged, and hats off to my men, but we also have many Black women that are in the front lines, that are the caregivers. And are we checking in on them, on their mental health, on their well-being? Many Black women are frontline workers. They're the teachers, the nurses, the personal care workers, the social workers, the custodians, the retail. We often find ourselves as women in very caring roles on the front line. I'm sure many of you remember when the nurses went on strike and the government mandated them to go back to work. Would they do that to doctors or would they give in to them? And they saw the nurses as being primary care, and they couldn't, they forced them to go back to work before they resolved their situation. And it was discussed, would this happen if the majority of the workforce was men in that case? And we have to wonder that. We saw the strike of the lawyers and what that result was. Many Black women are underemployed or work in low income positions. That's not to say that some of us on the phone are in different positions. We are, but there are many of our sisters that may not be in the same position that some of us are in. Many Black women are forced to go to work right now during COVID because of the positions they hold. And where is that support? So it's important to recognize the work of Black women in relation to health. When we think about Black women's lived experience, Black women have the highest risk for health conditions such as heart disease, obesity, stroke, metabolic diseases, yet there's this scarcity of research focused on specific interventions for Black women. And this is where we definitely need to start thinking about the importance of race-based data. And I'm so glad that provinces have begun to take that on, that Nova Scotia is looking at taking that on. There's research that I'm involved in that will look at that as well. But we need to, as Black people, be willing to have our race-based data collected. Because the only way we are going to get interventions that are relevant to Black people is to be comfortable in the collection of race-based data. So when that starts happening in our communities, I encourage us to step up. When we think about breast cancer, Black women are 43% times higher to die of breast cancer compared to white women. And there was a time that Donna, who's a cancer health nurse who's since been retired, talked about this and came to the churches about Black women and cancer. And I remember being in that age group around 40, or just getting ready to turn 40. And her research was indicating that Black women should be tested for breast cancer earlier because of the fact that our breasts are more dense and it can easily be missed. And when I took this to my doctor, telling her I want to go for a mammogram, she goes, "Oh, you're not old enough. You have to be 45, or you have to." I might have been 35, and you have to be 40. And I said, "No. Research tells me that Black women need to be tested at 35, and I need to get tested." And so the reason why we often die with a higher percentage from breast cancer is because we don't get tested early enough. So I encourage any of you out there who aren't excited about getting a mammogram, early detection is best when we open back up. I encourage you to do that. Standing for our men and colon cancer, and even our women. People aren't comfortable with that whole idea of checking for cancer. Black women often have less access to healthcare, as we talked about earlier, connected to job insecurity sometimes. And the social exclusion that Black Canadians make up, even though we make up 9.5% of the Canadian prison population, we only represent 2.5% of the overall Canadian population. So we shouldn't have those numbers in our prisons that we have. But then we have to go back again to our social determinants of health and to our ACE that we talked about. Black households are 3.56 times more likely to experience food insecurity. And I'm thankful that, again, thinking about COVID-19 and the support that's being provided to members in our Black community, we often don't think about food insecurity, which is often connected to income, which is often connected to jobs, which is often connected to education. So it's easy to see how the social determinants are connected and how we are so much so at a different advantage. Between 2001 and 2012, diabetes doubled among Black women from 6% to 12%. And we know that Nova Scotia has the largest obese population in Canada. And many of that is in our Black communities. And some of that is connected to food insecurities. Some of that is connected to inactivity, physical activity, and understanding and having opportunities. One of the research I did before was looking at the communities that have sidewalks. Many of our Black communities don't have safe walking paths for folks to get out and exercise. So I know Dwayne is on the call, and these are things that we talk about. It's challenging in many cases. Black people are more likely to live with experiencing pain or discomfort, have high blood pressure, or be overweight, obese than white people. And Black women suffer from the strong Black women syndrome. Those of us who are on this call that are sisters know what that means. We're not allowed to have a sick day. We're not allowed to take a mental health day at work. We're not allowed to just say, I'm tired. And so that whole expectation of Black women definitely impacts our health, our mental health, our emotional health, and our physical health. Many of us experience microaggressions. I won't go into this. This will be one of the slides that you're posted, where people just feel comfortable in saying things. Many of us have probably said, oh, can I touch your hair? Oh my heavens. Many of us are like, where are you from? Or you don't sound like a Black person. Or, oh my heavens, you're so articulate. And if we experience that on a daily basis, what impact is that having on us? I then want to jump into being silenced. And this is some of the stuff from some of the research that I've done within my PhD. So Black women often face the undue pressure to keep it together. It goes back to the strong Black women syndrome for the sake of their communities and families. And this pressure can cause us depression and distress. And we're not able to manage in some cases. The social structures of pressure, environmental factors may negatively influence racialized individuals' health outcomes. And so we do need to have talking circles with just women. We do need to have gatherings where women support and lift up each other. And in some of the research, people talk about coping strategies, and we need to explore those positive coping strategies more. And hearing from some of the women in the research that I've done, I just want to share some of what they say and how they've experienced it. So racism makes me sick. It damages my heart, blood pressure, and my unborn baby. Yes, our children feel that. So these are the voices of the women. I mean, racism makes you sick. You know, it makes you very sick. You know, sometimes I don't want to live. So we have Black women who experience racism on such a daily basis and the impact that it has on their health and well-being. And to deal with that, they might internalize it, keep their mouths shut, and sort of deal with it in different ways. And that's where you see some of the unhealthy behaviors, such as eating, drug and alcohol abuse, developing anxiety and depression. And that's often the result of experiencing racism. And some of us have gotten to the point where we just numb it. We just expect it. There it is again. You expect the worst and accept the worst, which makes it very difficult to move beyond the racism. So if I'm speaking to any of my sisters today, don't own that pain. I want to validate that pain. It is real. What you're experiencing is real. And people will say, oh, you're just being too sensitive. Oh, it's in your head. It's not in our head. We live it and we experience it. And we acknowledge the fact that sometimes we have helped other people get jobs that we should have gotten. And that's the institutional and structural racism is another layer that we experience. So we could talk about a lot of these things for a long time. Another person, I know that my children are hurt. It eats at my stomach. How many of us have had that feeling? I feel my stress internally. When our kids hurt, we hurt. There are days when I went to work with a smile, all the while thinking that one more thing might push me over the edge or what might happen to my child. Those of us who have children in the school system, those of us who are teachers in the school system, those of us who go to work every day and think about, oh my heavens, what's going to happen to that child or my child or within our community. And just to give you a quick stat and why we have to have more people going into our health profession, there was a research done or a survey done in 2010 in the Capital District Health Authority, where 1.5% of their employees identified as Black, but 3.5% of the district are Black. So why we have to fight for equitable healthcare, why we have to fight for diversity in our healthcare system needs no discussion. We know that people of African descent are often more comfortable in dealing with people who look like them, people who understand their lived experiences. We need to work towards making that happen in our healthcare system. And if it's not possible, we need to work better to serve our diverse communities. So I would love to see more people going into our healthcare system. And we are starting to see that, and that's important. So as I wanted this discussion, because I want to have more of a conversation with all of you, and we're already a little bit over time, I leave you with this poem that many of you have already saw. The Death of the Strong Black Woman. While struggling with the reality of being a human instead of a myth, the strong Black woman passed away. Medical sources say she died of natural causes, but those who knew her know she died from being silent when she should have been screaming, smiling when she should have been raging, from being sick and not wanting anyone to know because her pain might inconvenience them. She died from an overdose of other people clinging to her when she didn't have energy for herself. She died from loving men who didn't love themselves and could only offer her a crippled reflection. She died from raising children alone. She died from the lies her grandmother told her, mother, and her mother told her about life, men, and racism. She died from being sexually abused as a child and having to take that truth everywhere she went, every day of her life, exchanging the humiliation for guilt and back again. She died from asphyxiation, from secrets she kept trying to burn away instead of allowing herself the kind of nervous breakdown she was entitled to, but only white girls could afford. She died from being responsible because she was the last rung on the ladder and there was no one under her she could dump on. The strong Black woman is dead. She died from being dragged down and sat upon by unevolved women posing as sisters and friends. She died from tolerating Mr. Pitiful just to have a man around the house. She died from sacrificing herself for everybody and everything when what she really wanted to do was be a singer or a dancer or some magnificent other. She died from lies of omission because she didn't want to bring the Black man down. She died from myths that could not allow her to show weakness without being chastised by the lazy and hazy. She died from hiding her feelings until they became hard and bitter, enough to invade her womb and breast like angry tumors. She died from never being enough of what men wanted or being too much for the men she wanted. She died from being too black and died from again for not being black enough. She died from being misinformed about her mind, her body, and the extent of her rural capabilities. She died from needs pressed too close together because respect was never part of the foreplay that was being shoved at her. And sometimes when she refused to die, when she just refused to give in, she was killed by the lethal images of blonde hair, blue eyes, and flat butts, being rejected by the OJs, the Quincy's, the Cubas, God bless the Kobe's. Sometimes she was stomped to death by racism and sexism, executed by high-tech ignorance while she carried the family in her belly, the community or on her head, and the race on her back. The strong black woman is dead, or is she? And I say today that we as black women are not dead, that we have work to do and we continue to do that work, but we need to do it together and with the support of our black men. But we need to recognize that we cannot fall victim to the strong black women's syndrome, and that we do need to take serious our black health, but also recognize that the impact of racism on our health is real. So now I'll turn it over for some conversation and look forward to talking with my brothers and sisters this evening. Thank you. I think I stopped sharing, so hopefully I can get into the conversation. I'm coming. So I hope that just gave us some food for thought around Black health and some of the stats that are stacked against us, especially when we think about the social determinants of health and adverse childhood experiences, and how our health is often compromised because of things that are beyond our control. And yet we're often expected to rise above. I love it when people say, I don't know why Black people just don't pull up their bootstraps and move on. And one person said, because sometimes they don't have bootstraps or they don't have boots to pull up the straps. And so sometimes people will look at the problems we experience as Black women and Black people as if we created the problems. So I'm now open to discussion. Thank you. So does somebody else just cheer at this point? Oh, okay.
Yeah. Mario, what do you see these hands?
I see some stuff in the chat.
Mario. I have some comments.
Okay, go ahead.
So where do you see these questions? Are there questions on the side here?
In the chat there.
Anyways, I know that I don't see, I see comments where folks are saying the poem was very powerful. They're thanking Barb for such a powerful presentation. And there's one that liked how she highlighted about the Black women needing around the breast cancer screening.
All right. So
Are there any questions?
Let's make it easier. We have Dr. Barb Hamilton here, as well as we have the Nova Scotia Brotherhood GP here. So if anyone has a question around anything, Dr. Barb as well as Dr. Ron can answer the question.
And I'd also like to bring up a point that we're experiencing as Black people, and I know all of us are there, with what's going on in the US and the attack on Black people. And yes, there is some interesting conversation that people have been having around how do we talk to our kids when they see these experiences of open racism and lynching and killing of Black people. And it is a hard conversation to have. But one thing we need to do, and it goes back to the whole ACEs that I talked about, the adverse childhood experience, and even witnessing some of those experiences of violent racism can impact that person's social well-being and their emotional learning. So it is important to try and find a way to have those conversations, because if we dismiss it, then that's where some of the historical trauma begins to manifest. And we don't want to have that manifestation. All of us that have experienced historical trauma, it's not like it's going to go away. But we want to acknowledge it, talk about it, and find sensitive ways of having those conversations, especially with our children. Because I know sometimes growing up, people dismissed those conversations and didn't want to talk to us as children about the things that we saw. And even one of the other great talks, and I know that Charisma and Rhonda does stuff around dementia. And that's another thing that's rampant in our Black community. And so many of us, even now, but so many of us even before COVID, did not want to put our parents or our grandparents in long-term care facility. And that's because we're afraid of the cultural competency that doesn't exist in healthcare. And that's another area that we could have talked about in terms of the lack of cultural competency. And I know that Sharon Davis Murdoch, when she was working for the Nova Health Authority, started working on some stuff around cultural competency. It still is not near where it needs to be. And I'm sure if some of us took this time to share stories if we wanted to, or just talking about our own personal experience within the healthcare system, and even within our places of employment, and how we were made to feel as Black women, as Black people. And then how does that manifest itself? I often tell people that I almost didn't finish my PhD, and I'm sure we can all relate to wanting to give up in different things for different reasons because of the racism that we experienced that took such control of our body physically, emotionally, and mentally, that it took everything to get up and fight. And that's not recognized. And that's a problem that I have with our healthcare system.
Even like working on the front line, you know, as a Black woman or any type of person, really, the vicarious trauma can lie and, you know, and make you sick. You not even realize it that.
Yep.
So Barb,
So
there's some questions in the chat.
I can't
Marsha,
see
if you-
it. I can't see them. No.
Okay, can I read the questions to you, Barb?
Go ahead.
The first one is regarding the case of George Floyd. What are your views of posting articles or video that include images of him being murdered? Because there's been several conversations with friends who, like those images, shouldn't be shared at all for various reasons. So that's one question. Do you want to answer that first, or just keep going?
I'll answer that first.
Yeah, and I think I also often will turn to us collectively, because those images were hard, right? Those were difficult to see. And one of our challenges, particularly social media has done, and that's, I talked a little bit about the impact of social media, both in making us not love who we are, and also showing us how we've been victimized and how we are attacked as Black people. And so the challenge, because we're all home and our kids are home, is it's very hard to stop our children from seeing some of those images. But for some of us, those images, because it's almost like if you don't believe it unless you see it. And we often, and it goes back to, we often question, does racism exist? I can't see it. And when you see those situations, there's no question mark of how that person is being victimized and treated. The challenge is the impact it then has on those who have seen it. And that's why it's important to have a good counselor has a counselor. And I truly believe that. So it's always good to have that talking circle, that when we see those images, we should come together as Black people, and Zoom is amazing, and let's talk about this. Let's talk about that visceral response that we are feeling because of that image. Because we're not going to be able to control it. We're not going to be able to control. We're not going to be able to control social media. We're not going to be able to control the internet. We can't control what the media is putting out there. We can't control it. So if we can't control it, we need to find ways to manage it and deal with it and talk about it.
Okay, and I think that's a good follow-up, because there was something on Instagram where Will Smith said that right now that they're not talking about their filming. So it's almost what you were just talking about in terms of those videos and the images. It's just a platform for them to now, like, just put it out there. The next question we have, Barb, is we know that Black women have been impacted the most by the pandemic. Although we know that we have higher health disparities, what else do you know about how this virus is killing Black women the most?
Well, it goes back to some of the points that I talked about in terms of the positions that many of the Black women are in. Many of the Black women are the care providers, they're the nurses, they're the ones at home. So if someone is infected and they're staying at home, and if there is often a woman in the household, it's often the woman that's taking the risk to go and care for that person in the household. They're the ones who's feeding them, they're the ones who are taking care of them. And we're not always doing it with safety, such as with masks or with gloves and protecting ourselves. And we are such a caring by nature. Women of African descent have always cared and raised their community no matter what. If I were to say to anybody right now, and if Kim, who talked about having a brace on her neck because of her pinched neck, I'm hungry and I can't get to the store, one of us is going to say, okay, Kim, where do you live? Let me get something to you. And we're not going to say anything about, are you positive? How are you feeling? We will make something and we might put it on her step, but we'll be like, no, Kim, that's okay. Let me bring it to you. You can't move. Let me take it to you. Because it's innate in us to want to care for others because people don't care for us, right? So we are so quick to care for others. And then again, it goes back to being frontline workers, PCWs. A lot of our Black women are in PCW positions. Many of them are in those positions. So many are on the front lines. And unfortunately, that is how it is affecting many of us. We have to work in a lot of cases. We don't have the luxury of staying home. It also depends on where we live. We know we have intergenerational living, and I know COVID-19 response team talks about that. We have families living within families, and that's fine. I never question when I go to support my aging mother. I'm very careful when I go, but I'm not going to leave her in home if she needs something. And so those are risks that we take as Black people and Black women, and we do have to be cognizant of that. So we are more apt to put ourselves at risk than other people. That's my opinion. Other people might have another take, and I welcome that.
Yeah. There is another point here. Have you seen it or experienced prescription fees or abuse to charges that have been increasing more now since the pandemic took place?
Yeah, that's a really good question.
And then another, pardon me?
Go ahead. You're going to add another question
that they have here is, can you talk a little bit about education and how it relates to health?
Absolutely. So let's talk about the drug medication for a minute. Interesting enough, I have a partner who often requires medication for different things. And sometimes our pharmacy is so quick to not give us the no-name one. They want us to sometimes pay for the expensive drug. And most drugs have a drug that's a sister drug to it. And in terms of, it goes back to the whole health insurance that often many of our Black families are often affected by, that we don't have the health insurance. And you're seeing an increase in a lot of costs. Like even on a call I was at today with my research team, and it's so evident how folks don't get the experience of Black people. And one of my research friend was saying, I look forward to traveling because there's not going to be as many people on the plane and the costs are going to be high. So I'm going to have an easy time of traveling because I don't like sitting beside lots of people anyway. And I was just sitting there and saying, you don't even realize your white privilege and what you just said. And that was so frustrating to have to hear those things. And the other thing that we talked about, one of my sisters, was the fact that I can't wait to get to my cottage or my cabin. And that's not the reality for a lot of our Black families when it comes to our children and opportunities to get out. So I moved away from the pharmacy question. So I think you have to use some of the resources that are in place, such as the COVID-19 response team. We need to advocate for equitable health care. We need to collectively advocate for health care. And I mean, we have organizations like DPAD, we have organizations like a HAWK, and I think people need to engage with those organizations. I remember very well HAWK being very successful in getting every child tested for sickle cell. And even before that got passed by law, so every child, regardless of the race, is now tested for sickle cell. I remember having to advocate for my babies to be tested for sickle cell, because it's not something that you used to get automatically. And 2 of my children have the trait. And so if I didn't advocate for that as a parent and knew to advocate for that, if they had a partner and decided to have children later, it could be a different situation we're looking at. So the more we advocate for changes collectively in our healthcare system, the more those changes will happen. The same way you're beginning to see more and more Black communities advocate for race-based data collection, we're going to see it happen. And even though it took COVID-19 to somehow make people realize Black communities are being affected more by COVID-19 across Canada, they're now at least listening to us. And sometimes it takes a crisis, and that's unfortunate. And that's how come we live in such trauma as Black people.
Mhm.
We're often living through crises for change.
So Barb, your other question was in regards to the education. Yes.
Mm-hmm. And so
I know
can you
it's a
repeat
big
the
one.
question again? Can you repeat the question for me again, Karen?
Yes, I can. The question is, can you talk more about education and how it relates to health?
Oh, yeah. I really look forward to being part of the Women's Health Alliance and having more of these conversations. Because another research project that I'm currently engaged in is looking at the testing scores of our students of African descent in the province of Nova Scotia. And you wouldn't be surprised how our children are doing in testing scores. So we're looking at testing scores from grade 4 and where our children fall on that within testing. So our education system, and this is some of the stuff that will be written within a paper that's coming out soon, we talk about the fact that our children are still experiencing self-fulfilling prophecy within our school system from every grade. Our children often enter the school system, and this is from parents and from tests, and because your children get tested in primary, which many people don't know. As early as primary, children are being tested in their social development, emotional learning. So that they're tested early and often by teachers who are white. And so even the testing that we do within our public school system isn't culturally relevant to our children. And so if I can give you an example of a child in primary being tested or evaluated around their social development, the EDI, and you have a child who's coming from a family community, a community. They grew up in their Black community. They went to Sunday school with their cousins, the people down the street. They're really connected to their community. And then we decide as parents, guilty as charged, we're going to put our children in French immersion because French immersion is great school. It's going to be amazing. They're going to do well. And they go to this French immersion classroom and they're one of two or one of none in that French immersion primary class. All of a sudden, they don't know any of the kids. They're not talking to them. They're not playing with them on the playground. Guess who gets labeled as having social development issues? The Black child. But nobody's questioning if these white children have learned the idea of being able to work with diverse populations and go over and make this child feel more included. So as early as grade primary, our children's social inclusion is already being questioned. And so if you begin to get questioned that early about your response to testing, your response to the education system, you now have a bullseye on your back. Everything you do is now going to be measured from that lens. And so in looking at some of the research and hearing the stories from the families and the women, it's really impactful because one woman talked about her child can do well in academic math in the Afrocentric summer math camp that BEA does, and they do amazing. Then all of a sudden they come to school and they're not able to do the work. One parent talked about, and this is their words, not mine, they were asked by their school supports principal for their child to take a lower math. And the mother fought against it. She said, I don't want my child in the dummy math, is what she called it. My child has the ability to be in academic math. Why would you suggest my child go in that math? And the teacher said, because the workload is less.
Wow.
So we have to be on top of the education system. When I look at children and students in post-secondary institutions right now, at Mount St. Vincent, we do not have one Black person in an education program from Nova Scotia. And I don't know what that stat is at St. FX or Acadia. But I do not hear, and not saying that having Black teachers and having Black principals change the environment, but it definitely helps our students to see themselves represented. And if we use the example, and I'm not saying this because Karen's on the call, of the Afrocentric math cohort, we are seeing amazing success when our students work together and when they're being taught from a lens of cooperation and collaboration. Our school system is not set up for our children to work cooperatively or collaboratively. It's an individual system. And as Black people, that's not how we function. That's not how we learn. That's not how we communicate. And so we have talked about within the Afrocentric Learning Institute of shaking up our education system. And I'm hoping that in the next 2 years, you'll see some of that shaking up, where we hope to look at how can we start having an Afrocentric school, particularly from primary to grade 6, and help kids get the foundation of their learning from people who look like them, sound like them, understand them. And we're not at any point to roll it out, but we are talking about it. And the community has been talking about it for some time. But we do need to take our children back from the system. And we need to be involved in the system. And we're not, and some of us are involved in the system and some of us are not, because we experience our own historical trauma in the system. So for some of us, it's hard to go to that school because of the historical trauma that we experienced as a child in that system. So I'm still hearing those stories as well. The same thing that happened to me as a child in the public school system is now happening for my children. And so,
can you,
yeah, go ahead.
oh, I was just going to say that based on that point there, when you're talking about education, how it relates to health, how do you see it now that we're in this virtual life? You know,
Yeah.
the students who, based on the collaborative and that cooperation, how can our students now, when we know we work well as a community, can we bring that experience to this computer life?
Yeah, I think it's going to take a lot of work. And I was hoping to have been on the parent call last night, because I say that because for some of us who are educators, both at the public education level and at the post-secondary level, we are experiencing the same challenge as those who aren't in the system, who aren't teachers, who aren't professors. And what I mean by that is, even though I have all the resources in my home, I have the computer, I have the internet, I have the passion and love for education, I can't make my child, who is 17, feel the same way I feel about education. And that's really hard for me. I can't make him sit in front of that computer and do his pre-cal. And he's doing amazing in pre-cal. And I'm not saying this to just point him out, but he feels like the system's messed up. They shouldn't be expecting us to be learning online, and some of us are on and some aren't. So he tried to go online, and there'd be like 5 people, and he's like, I'm not doing this, Mom, no one's showing up. And it became hard to motivate him. So we have to find a way, not just as parents, but as a community, to try and figure out how we're going to collectively educate our children. The curriculum for the Nova Scotia, for the public school system, is on the website for free. Anybody can download the curriculum outcomes from P to 12. And, oh, David, you need to plug in my computer. From P to 12. It's over here somewhere. Can you just find it? Sorry, my computer's getting ready to die because I took it with me when I went out. So I have to get my computer plugged in because it says the battery's low. So we have to begin to think about how can we collectively, just one second. It's already on the floor. It's just that it's on the line. I found it. Okay, we're good. Emergency averted. We have to think collectively, what can we offer? And so I would challenge us as educators and parents who are interested to think about how can we look at the Nova Scotia curriculum? How can we start developing our own classes? And this is where we start our Afrocentric school online from grade primary to 12, and try to encourage those who are willing to come on to come on. We may not get everybody, but we may get some. And I think that we have to start taking ownership for the education of our children if we can, but recognize that it's not your fault. Because we will personalize that, oh my heavens, my child's not learning, my child doesn't want to go on the computer, and we'll fight with our child to get on the computer, we'll fight with our child to get to learn. My child is not a virtual learner. And I'm worried about what's going to happen in the public school system when we go back to school if we're not in school. And I have another child who's in his 2nd or 3rd year university, and he has openly said, because the university's already announced they're going online, well, Mom, I'm only taking 2 courses because I don't like to learn online. So that's why I'm saying it's from every age is struggling with this new, and I'm not calling it the new normal, this new way of learning. And we have to collectively find a way to work together. And if that means going back to trying to find cohorts of people that say, you know what, I have this skill, I can teach this subject, do your children want to come online, or how can I reach them? Because we can also now gather 5 people in an outside environment. There's nothing like being outside in nature and having, tables of 5 sitting around and start chipping away at what we can do. We have to realize that this isn't working for anyone. And I am very worried about our Black children falling behind.
Me too.
And very, very worried at all grade level, both public and post-secondary. And that is a concern. I know at university, we are going to be making allowances and teaching differently for the first 4 months of our courses. We've been talking about that for those who are coming from grade 12, because children didn't finish almost a whole term. And we know that. Especially if you're going into some of the sciences and even the arts. If you're doing engineering and the Bachelor of Science and you need to have all your calculus and you only get to March, and we're going to start as if you have it, it's not realistic. So there's lots of work to do, and I think we need to collectively have a conversation of what can we do.
You have a few more questions in the chat box, so I'm going to go to those, Barb. Can you speak about going to the doctor's office and being refused because of your postal code? I think that was a question that came up. Can you, what is the current status of the Afrocentric curriculum in the Toronto School Board? That's a question. And then can you speak to how 37% of African Americans are homeschooling their children now, and why our students cannot reciprocate? And then there's a question in there about, child abuse, as well as more about domestic violence for our children. My daughter's in grade 2 and her teacher has a Google Classroom once a week, but only 3 kids show up on a weekly basis. So those are some questions that are coming up. So I'm not sure if you want to talk about the postal code, going to the doctor's office first, and then get back to children.
We can work through those. It goes back to some of the stuff that I talked about in terms of being silent, right? So even when we were, trying to get moms back specimen checked out, and they asked the typical questions, but they knew not to ask the postal code. One, people taught them that, but they did ask, were we in Northwood and blah, blah, blah. But in terms of the postal code, people need to call out those situations. And we are so afraid because we're worried that we're going to get penalized. We know how difficult it is to find a family doctor. We know how difficult it is to get health care. And so we're afraid that if we tell somebody that I got denied because of my postal code, that we're going to be reprimanded by that healthcare professional. You're already being impacted by that healthcare professional's response. There's already an underlying experience of racism and discrimination. So you have to ask yourself, do I want to continue getting care from that doctor or from that healthcare practitioner at the expense of my emotional, physical well-being as a person of African descent? So there's places where you go and report that. And even if we say, nothing's going to be done, why am I going to bother? The more people that report it, the more it becomes relevant. And so even if that means that we have to support in Writing Letters campaign, even if it didn't happen to us, it goes back to that bystander seeing. Even if it didn't happen to us as Black people, we felt it as Black people. So writing those collective letters about the impact of one of our family members experienced refusal because of their postal code, and call out who that was and make them accountable. But you have to ask yourself, do I still want care from that practitioner who's placing a stereotype and a judgment on me because of where I live?
Could I just add something to that?
Yep.
Let's Dr. Ron. Anybody that experiences anything related to refusal of care because of where they live or because of their postal code, I would strongly recommend that you report that to the
Absolutely.
And surgeons, and it will be dealt with. I can tell you that will be dealt with, because that is completely unacceptable in today's medical society. So yeah, I would definitely, the College of Physicians and Surgeons, their website, I don't have their number, but they have a website.
No, but I can find it. And I know that the guy who's in charge of it, he is in well support of he's knowledgeable of the Black community. He's an excellent advocate, and would love to see more Black people. I would, don't hesitate to report it. We need to report those situations. We can't suffer in silence. In terms of the homeschooling, there's a couple of students that I have at the institution at Dow and other places who've been very successful with homeschooling. But again, we have to think about where we're coming from as Black people and even as Black women, where we know that a lot of the care ends up on being Black women when it comes to teaching our children. And so we also know that in a lot of households that women might be the head of or responsible for, we're often having to work outside the home. And if we're not working, so how are we able to manage homeschooling our children when all those other social determinants of health impact our ability to even be at home, to homeschool our children? And so I remember when my child, and I'm very open in speaking about my family because that's how others learn. So I remember when my child was having challenges in the public school system, and I called it one of my teachers, because most of the learning that happens in the classroom, I'm not taking anything from my teachers, isn't 8 hours of learning. So I remember calling up a teacher friend and saying, hey, I will take my child to my mother's in the daytime if you will tutor him and teach him for 4 hours after so that he can get what he needs. And it's concentrated teaching time. I was ready to pull my child out of the school system because it was not working for him. And so again, it goes back to how can we collectively find folks who are able to stay home and who have the ability to be able to collectively teach children. Because some homeschools, they do it collective. Like if you were to Google homeschooling online, there are some families that will take other children and homeschool them. And that may not work for our Black community, but that's an option to look at as we begin to say, how are we going to develop a school relevant to Black people? So homeschooling is an option to any of us, but it's having the skill and having the ability and having the time and resources to be able to do that. And there is support through homeschooling when you need support online through the Nova Scotia Department of Education. So if people are thinking about homeschooling, then I would encourage you to think about the Department of Education, but I think it'd be great if we could somehow find a way to support each other in this challenge as well. We are all in this together with different skill sets. There's amazing writers, musicians, mathematicians, scientists on this call. So just imagine if we were to start working collectively on our small nuggets and making a difference. Oh, learning disabilities. I saw something about learning disabilities.
Another question. Do you have a union or a body where Black workers and patients facing racism, discrimination can go to share their
I know that we're trying to develop one, and this is relevant for those who are clinicians on the call and who had to do placements, because I had an honor student do some research around the experience of being, in this case, Black, a lesbian, and queer. And she was doing a clinical placement. And she talked about how patients didn't want to see her because of how she identified. And there's many clinicians who have gone through that experience that are Black on this phone call. And so you do have a right to report it to your union, but it goes back to some of the things we talk about around Black health. We are so not comfortable to sometimes name it when we experience racism, because most of our working in institutions or places that are predominantly white. And so we probably don't feel that what we're experiencing will be validated. And so that's when we begin to internalize it. That's when we begin to experience depression, anxiety. That's when we begin to medicate in different ways. And that's where we need to have places and more counselors, psychologists that we can talk to about what we're experiencing. Because even being on the Black Mental Health Alliance page, or Black Health Alliance page, and listening to a couple of stuff around COVID, and I was listening to one podcast not long ago about a Black man, heterosexual, who experiencing body dysphoria. And he went to go see a mental health clinician about it. And it was a white mental health clinician. So he goes, how am I supposed to talk about the expectation of a Black man who's Jamaican, but yet I'm experiencing this? How is he going to relate to me and what I'm experiencing? So we often suffer in silence because of that. So I know we're trying to look at ways of having, and I applaud those who are starting the process of offering services as counselors and as resources for Black people to come to just have these conversations and to have those experiences validated. But I think it's important, just like the postal code one, to document them. We need to have this documented. And that's what's really hard for people to do.
Just want to let everyone know that we have 15 minutes left, so if you have any more questions, you can put them in the chat, please.
I wanted to touch on the child abuse and the domestic violence. And that is some of the impact that is really affecting our Black community as well with COVID. And having many of you on this call who work in the school system, we know that for some kids, the school is their safe place. We know for some kids, the school is where they get their meal. We know for some people, the school is where they get their emotions and their feelings validated. And that goes back again to the strong Black woman and those of us who are in the healthcare and education system. I know that we're carrying the weight of those kids who we know are suffering right now. And it's difficult to think about the apprehension and to think about the violence that could be even happening to individuals, not just women, but even men experience domestic violence. And even though it's COVID-19, it is our duty to still report. And that's hard. Because what often happens, and it goes back to some of the stats where I talked about Black men and some of the research that I do, Black women who experience abuse at the hands of Black men don't often report it. And they don't often report it because they know how the criminal justice system operates for our Black men. And so that again is where they suffer in silence. So during this time of COVID, we need to have some like-minded people thinking about and talking about what are some of the gaps in the resources. We know what they are. What we need to figure out is what are we going to do to fix those gaps. And I know that DPAD and HAWK and other community organizations are beginning to develop branches that are saying, okay, what's one of the areas we need to work on, Nova Scotia Brother Alliance, and starting to put warm bodies around that. Some of us want to be involved in everything, and we can't. We need to pick our expertise, work hard in that area of our expertise in order to make that impact. As the old folks say, or other folks would say, stay in your lane and make that lane amazing. And we really need to start thinking about what are some of the gaps for people of African descent, and how can we collectively work to reduce those gaps and to call it. I remember there was a film, No More Secrets, that was done around the violence of our older Black women. And it is real. And we do need to acknowledge it and find ways to support it. But we have a duty to report. And that's really hard.
I'm not sure if anybody else has any more questions. Marsha's frozen. But Barb, I just want to know if you could just elaborate a little bit more on the social inclusion, because as an educator, I'm not just concerned about the academics. I'm also concerned about the social inclusion for our children. Mm-hmm. And I know we talk about the gaps, but the gaps also going to include social inclusion. Absolutely. As they return back to whatever this abnormal is going to look like in the future. So I just want to know if you could speak just a little bit more to that as a health person, an educator as well.
Yeah, that social inclusion is real, and that's one of the social terms of health, right? People are healthier emotionally when they feel included, and when they have that sense of belonging. And I'm worried for in our classrooms, and we know, and I don't want to go down that road for discussion because that's a whole other discussion, because we know when some of our kids in our classrooms are on IPPs, and everybody knows it, those kids often experience that social exclusion in that classroom. And it's very difficult for them to shed that stereotype that often gets attached to them. And I remember teaching in a junior high and that being the experience of a child that I was working with. So we need to make sure that those in the education system, because everybody's going to come back ready to teach and just focus on the curriculum and what kids need to learn. And they may not be thinking about the social determinants of health and the impact that COVID had had on people because of their race, because of where they live, because of what's happening in the US, so a lot of weight will go on administrators, and I put that in quotes, Karen, I'm not expecting you to do it all, will go on some administrators to make sure to educate their staff on other areas that need to be taken into consideration. And to not go back and expecting every child to be where they were when they left off, because we're going to bring that trauma into the classroom. because we all are experiencing COVID very differently. And even as we get ready to go online teaching at the university, one thing that we're telling every student to put a backdrop if we're doing virtual teaching. No one needs to be in your home. No one needs to judge and look around and say, oh, look, they don't have much. And we know that happens. We know that people are on these Zoom calls and they're looking to see what your home looks like. And so to create a level of equity, we are telling all our students, if you're going on to any Zoom call, put a background. And if you don't put a background, we're stopping the conversation until there's a background. And so it's hard to say what's going to happen in our public school system, especially when you think about on our Dartmouth side, and I'm sure others are affected as well. But some of the discussion that has been made about our Preston communities in terms of North Preston, East Preston, Cherrybrook, Lake Loon, and the apprehension that some teachers are going to have. And I say that because it's real. Because one of the research that I was reading, and we were reading about a guidance counselor in one of the schools that takes care of kids in the Preston community, and some of the stereotypes that this guidance counselor was saying about Black children scared me. And this is, before COVID. So we have folks in our school system that are still not supportive of our Black learners. And so we need to figure some things out around that. And how we're going to create that level of inclusion. And we're going to, and if parents are able to, depending on what your work life might be, being able to be present in the school as it begins to transition and talk about those challenges. I remember going into the school with my child who had some emotional challenges and having a whole conversation with the teacher about my expectations. And the teacher looked at me and she did not skip a beat. And she said, oh, are you his social worker? So even as involved parents, people make assumptions about our role in our kids. Those are our biggest value and asset. And whatever we can do to support them, we need to find that way. And it may not be you, it might be your next door neighbor. But collectively, we need to figure out how we're going to support our children because they are going to feel that sense of exclusion. And we need to be aware of it and watch for it.
There was a comment in there from one of the participants saying that there are in her school there are social workers who are actually dealing with the social inclusion part in terms of very intense. They do it twice a week where they meet with them. There was one other comment dealing with bullying.
Yeah, social inclusion is bullying, and I saw that. And the
Okay.
school has a no bullying policy, or at least we're supposed to. And so it goes back to making sure the schools are accountable for when a child is experiencing that, because that is a form of bullying. And there is supposed to be a zero tolerance policy in our public school system around bullying. And again, it's trying to get our children comfortable to talk about when they're experiencing those things. And again, because we don't talk about racism, some of us within our household, I know that my child has told me I'm racist because we talk about it all the time. So we work through that. But some of us don't talk about what our children are experiencing. So we're not comfortable in talking about racism and what might be happening to our child, or exclusion because of learning disabilities, or exclusion because they don't have the right shoes on, or a brand name shirt. Bullying and exclusion demonstrates itself in so many ways. And our schools need to be held accountable when that does happen.
Are there any more questions? It says hi, record the meeting. Okay, one person wanted to know if the meeting's being recorded, and it is. And so it should be made available to online, to Facebook. All right? Any more questions? Because I'm not seeing any. Comments?
And there was one comment that I saw about the bullying in the workplace. In every place of employment, and I applaud, and I'm not saying that we have it right at Dalhousie because there's still lots that need to be worked on, but at Dalhousie we have started to implement a number of resources to support diverse populations, from LGBTQ to Indigenous to Black Nova Scotian, and we are making people both at faculty, staff, and administrative levels accountable for some of the actions and the treatment of our racialized staff and our staff coming from diverse populations. And we actually at Dal are trying to be active in recruiting underrepresented groups. And what I mean by that, We know the gaps around our staff. We know there's too many of our staff that are in custodian positions that are Black. We know that, we recognize that. And we need to work to change that. So we know in our institution where some of our vulnerabilities are, and I'm sure that all of you can say that within your workplace. And so every workplace should be having some type of equity policy to support their staff that are coming from diverse backgrounds. And if they don't, you need to ask them, because by the government, they are held accountable. And in case they may be on the call, around human rights and equity. And again, we don't often challenge those. And some of us have had bad experiences, and I'm sure things have improved since. And so we need to get rid of some of our historical trauma we carry around the Nova Scotia Human Rights Commission. And if you are being offended and affected, there's other places we need to report it. But again, it goes back to us being afraid to report it because we're afraid of losing our job, which is connected to historical trauma, which is connected to social terms of health. So this is vicious circle that we live as Black people and how we are impacted. I think we're over our time.
I think we are over our time, is correct. I'd like to thank you, Barb, for the presentation that you delivered to us. I think it was very informative and thorough, and it touched on a lot of important information in regards to trauma that most folks experience, especially Black women and Black men too. And so it gave us a lot of things to think about. And, you know, I think it's time that we continue to have conversation in regards to trying to come up on how we can work together as, you know, as women and men, because the men are involved too, and, you know, achieving some of these, addressing some of these issues and concerns.
Thank you, Marcia. And I know we didn't talk much about coping strategies, but I mean, sisterhood is a big coping strategy. A lot of us are spiritual people. The church, even though it's not, you know, in person right now, there's a lot of great places online to get spiritual healing. Meditation and mindfulness are powerful. Taking walks where you can, and being kind to yourself, and really recognizing that what we're experiencing as Black people, we didn't create it. We are the strongest, most resilient people. And when we had an opportunity to travel to Ghana, and I'll leave you with these last words, and we went to the door of no return. And the people in Ghana said to us, "Welcome home, sons and daughters of our strongest ancestors."
Wow.
Welcome home, sons and daughters of our strongest ancestors. That speaks to our resilience and our strength as people of African descent.
That's powerful. I mean, I feel privileged. Yeah. Ashe. Thank you, Barb.
Thank you.